putting others at risk. We will get through this, but everyone must use good sense and good judgment. Today, we are announcing the following things. First, Virginia will follow the federal guidelines regarding gatherings of 10 or more people. As a doctor, I understand that this virus spreads through human-to-human contact. Droplets from sneezes or coughing if people are too close, or they can be left on objects like door handles and our cell phones. That's why it's so important that people stay away from close contact. Second, we strongly urge those aged 65 and over to self-quarantine. Please protect yourselves. It is important that we make sure older Virginians in this situation can still get food, medicine, and other needs met. Our state agencies, our food banks, faith-based groups, and other nutrition-based organizations are working hard to coordinate food services. This may look different in different communities, but everyone who needs food assistance will be able to get it. I also urge everyone to make sure you check on that older neighbor or your parents or grandparents. Help people out with grocery deliveries. Make sure that they're okay. Again, we all have a responsibility to one another. We understand that the 10-person standard will have an impact on a number of businesses across our society. It means that all restaurants, malls, fitness centers, and theaters must significantly reduce their capacity in compliance with this 10-person standard or close. Restaurants are encouraged to continue takeout options. I understand that this affects people's livelihoods. We are taking the following actions to help our workers. Because Virginia and the federal government have declared states of emergency, unemployment funds are available through the Virginia Employment Commission to help mitigate the impact on employees of these businesses as well as on the businesses themselves. We have waived the 1-week waiting period so workers can start receiving benefits right away. We know that rent and other bills won't wait. Affected workers and businesses can contact the Virginia Employment Commission for information on how to apply for help. Today, I am ordering that Virginia's 75 Department of Motor Vehicles offices close to the public. Online services will still be available, and we encourage anyone who needs to renew their license or vehicle registration and can do it online to please do so. For those whose licenses or registrations expire May 15th, we will grant a 60-day extension. People need to do the right thing. Everyone has a role to help mitigate the spread of this disease, of this virus. That starts with social distancing. It is critical that we all think not of ourselves at this time, but of others. Young and healthy people may think this won't affect them, but I hope they will think of their parents and their grandparents. And I urge everyone to think of their neighbors, their communities. Public health relies on every individual making responsible decisions. We all have a responsibility to each other. We can and will get through this difficult time, but we must work together to do so. Now we will hear from Virginia Health Commissioner, Dr. Norm Oliver. Dr. Oliver, thank you.
Thank you, Governor. As the Governor said, we currently have 67 cases of COVID-19 in the Commonwealth. Since yesterday, that's an additional 7 new cases. And we are expecting results on about 48 other tests that are pending in our state lab right now. And there are tests that have been taken and are being run by LabCorp, Quest, and other private laboratories. So that number will increase. The Virginia Department of Health will be posting at noon each day the numbers that we have in the morning, so that would be one way to check this. And in addition, of course, there will be these daily news briefings by the governor. Among the cases that have occurred since yesterday is one case in a long-term care facility. And this is very concerning. This is our first case in a skilled nursing facility, and we are actively investigating this case, working in collaboration with this long-term care facility to isolate and make sure that the infection does not spread to others. The breakdown of those cases, the 67 cases are 9 in Central Region, 18 in Eastern Region, 38 in the Northern Region, 4 in Northeast. We still have no cases yet in Southwest. While the majority of the non-travel related cases are cases that have been associated with other known cases, that is very local transmission, we have now begun to observe cases with no known exposure to a case which is what we would classify as community transmission or community spread. So the likelihood of community spread is definitely there. Some local transmission, such as in the Peninsula Health District, has resulted in clusters of illness, which reinforces the importance of what the governor has talked about already, which is the social distancing. I would like to say also, for those young folks who think that they're not affected by this, I want to underscore what the governor said about how social distancing on your part will protect our elderly. It's also important to know that although 80% of those who get COVID-19 have mild disease, that statistic comes from looking at the pandemic in China. And everything that was listed as mild was everything other than the severe disease. So included in the mild category is some pretty bad pneumonia. I don't want you to think that you're just going to get a cold, okay? This is a serious pandemic, and social distancing is therefore something that we all should do and take seriously for ourselves, for our loved ones, and for the entire community. We currently have a testing capacity of about 300 to 400 tests. We have on order and will be receiving today more test kits, which should nearly double that amount of tests. Private companies are online to help us with the testing, and many of you heard from the federal government of plans to launch automated testing and drive-through test sites around the country. The first wave of that will occur in those areas that have been hardest hit, like Washington State and California. But Virginia is in that next phase that should get those tests from the federal government. So we will be ramping up our testing capabilities in the days and weeks ahead. Thank you.
Thank you, Dr. Oliver. Well, in closing, I want to reiterate that it is everyone's responsibility to use common sense at this time. And I also want to repeat these basic health precautions. As we have said every day, please continue to wash your hands with soap and water. Cover your mouth and nose if and when you sneeze. Stay at home. Let me repeat that. Stay at home if you feel sick. And avoid touching your face. I thank you all again for being here. As I said at the opening of my comments, we will get through this together. We live in the best state and the best country in the world, and we intend to keep it that way. So I'll be glad to take your all's questions. Henry.
Governor, could you talk about drive-through testing? We've seen some with Sierra right now.
Yes.
How do we see more of that in the state?
Yes. I think a lot of it, Henry, depends on the capacity. And certainly, we have a limited number of tests available still. So I appreciate your question. And so individuals that will drive through these facilities will still be screened. They will be asked about recent travel. They will be asked about contacts. They will be asked about their symptoms. Do they have a high fever? Do they have a cough? Do they have shortness of breath? And if they meet the screening criteria, then they will be tested. If they don't, then they won't, again, just because we don't have the number of tests. But I would reiterate what Dr. Oliver said. Each day is getting better. And as you heard last night or yesterday evening from our president, we intend in the next week test in the country. So every day is better, but we still don't have as many as we need. So I want people to understand it's not just everybody drive up and get tested. There still will be a screening process.
Yeah. Governor, the health commissioner noted we don't have any cases in Southwest Virginia at the moment. And some people might be inclined to go out tonight and party or go out and do more than they should. What do you want them to know in
of the James City County Board of Supervisors for a special meeting. Mr. Stevens, please call the roll.
Mr. McGlennon?
Here.
Ms. Larson? Here. Mr. Hipple?
Here.
Mr. Eisenhower?
Here. We need a motion to allow Ms. Sadler to participate in the meeting remotely due to a medical condition that prevents her attendance.
So moved.
Okay, we have a motion. Mr. Stevens, call the roll.
Mr. McGlennon?
Aye.
Ms. Larson?
Aye.
Mr. Hipple?
Aye.
Mr. Eisenhower?
Aye.
Motion carries.
Okay, so we are now down to board discussions and guidance, and we will start with Mr. Stevens on the confirmation of our March 13th, 2020 declaration of local emergency.
Mr. Chair, we've got that. Our attorney could cover that more, but it was just making sure we've taken appropriate action to set the county up for whatever assistance or reimbursement might be available. So, Mr. Ginsman?
That's correct, Mr. Stevens. Good afternoon, Mr. Chairman, members of the board. What I brought before you is a resolution confirming the declaration of local emergency that was adopted on the 13th, and an amendment to that to add the word disaster that will allow you to avail yourselves of a few more Virginia Code sections. Happy to answer any questions you might have.
The only question I have is we have the resolution, and then there was another amended declaration. Is that something separate?
It's the amended declaration is what the resolution will allow Mr. Stevens to execute.
Okay, very good. So, oops, I'm sorry. I just want to make sure that they both did go together. Okay, so we need a motion to adopt this resolution.
Motion for adoption.
We have a motion. Any discussion? Mr. Stevens, call the roll, please.
Ms. Sadler?
Aye.
Mr. Hipple?
Aye.
Ms. Larson?
Aye.
Mr. McGlennon?
Aye.
Mr. Eisenhower?
Aye.
Motion carries.
Okay. All right, we've got that. And then we are now to COVID-19 update and current conditions, future considerations.
Mr. Chair, members of the board, I thought, and I'm happy to go in any order you'd like, that we would have a few short briefings and then see if you have questions, and then we would lead into whatever discussion beyond that. I did want to bring up our fire chief, social service director, assistant county administrator, and our Latara Rouse to talk about fire and sort of their response, social services and community issues, county operations, and then communications. So those are really the four topics, and then whatever else you'd want us to branch off into. I'll have a little wrap up on my side about budget implications and just talk some about that. But that's the four presentations we put forward. If you're fine with that, I'd ask Chief Ash to provide his update.
Morning, thanks for having me. So you're aware of the 11 cases within the Peninsula Health District. James City County is part of the health district there that covers all of the peninsula. You may hear in some other discussions that individual cities or counties may have their own health district, but we participate in the peninsula. There are 11 confirmed cases, and you can see that on the Virginia Department of Health website at the map located at the bottom. But as you heard the governor say earlier, we know there's additional tests out there, so we suspect there are some other positive cases that we're just not aware of at this point. So we've been working really over the last couple of weeks getting ready for this type of event. There's been a lot of coordination, a lot of conference calls, information being shared from the localities here on the peninsula, the State Department of Health, the local health district in the peninsula, and with Virginia Department of Emergency Management. So over the last, over the last couple of days throughout the weekend, we really started a much closer coordination as we started to see cases show up, and then with the first death that occurred in our locality. So yesterday, we really got started with a peninsula effort, and I think that's kind of the biggest thing I could share with you is the peninsula localities all agreed yesterday to come together to form a regional operations center located in Newport News, and that's really we're sending representatives there to help coordinate the law enforcement, fire and EMS, emergency management, and the public information sections. So we have representatives there from hospital, Virginia Department of Health and Peninsula Health District, and then all those disciplines. And we've agreed to share that really as a regional effort, so we're rotating staffing, so not every jurisdiction is sending somebody every day. So we share that, and we'll be able to sustain that for a longer period of time. And we're calling it an operations center, but I think really you can think of it more as a coordination point. So we're able to share the better flow of information from the Department of Health, from the hospital systems, and from what our first responders are seeing out in the field, and then package all that in a joint information system, and so we can get that information out to our PIOs so that it's timely and it's accurate as possible and the most up to date. So it's really remarkable to see all the peninsula jurisdictions, the support from the county administrators, city managers, fire chiefs, police chiefs, emergency management folks to bring all that together. So we've been down there this morning, still getting things stood up. We did get some assistance from the Hampton Roads Incident Management Team, which is based out of City of Chesapeake. However, we have most all of our jurisdictions in Hampton Roads have members that participate in that. So we've had a couple members over who have experience. They've been deployed out of state for helping run EOCs during Hurricane Florence, and so they've been in North Carolina, Texas, Florida, those places. So they really bring that experience piece to managing. This is certainly something outside of what we're normally involved in, and maybe has only been done in some tabletop level drills. So their expertise has been helping us get steered in the right direction, get organized in a way that has a good structure that's expandable. So as we go over the next coming weeks or months, we're able to expand that and make sure we're coordinating all those resources. So it's really been a great effort. Things are in progress there. Hopefully we'll have a better report tomorrow of how that structure has been set up, and we'll start to see the work that's being done there and the better coordination. So that's all I had to report.
So I have a question. How is the information being deciphered? So somebody goes to the hospital, there's a drive-through testing, they test positive. I guess at that point, the hospital makes the decision on whether or not to bring them into the hospital. And then who is getting that information so that we know that I was rather surprised to hear that we had a cluster because I hadn't heard that before, and that's kind of leading to some of my aggravation. But so does Centera notify, or Riverside notify the health department that then is supposed to push out the information to us, or what's the flow chart look like for information?
So I'll be honest, some of that's what we're working to really coordinate in a better manner. But as I understand it today, any testing that's done at a state lab is coming back to the Virginia Department of Health, and those are cases that it's easier for them to confirm because it's done at their own laboratory. The cases that are being done at a hospital system, or if we eventually get to a point where doctors' offices are sending information out to LabCorp or Quest, and we heard the governor talk about those two, that information flow comes back to the medical professional or to the doctor's office or the hospital system, and then has to be relayed over to the Department of Health because they're separate laboratories. So I think we're really trying to work, at least in the Peninsula region, how to streamline that communication in a way that we make sure everyone who needs to know is looped in. There's certainly a lot of HIPAA regulations regarding what can be shared, so it's hard to share specific patient information, addresses, and things like that, but I think there's also some initiative to talk with the state level about relaxing some of those, certainly not for public consumption, but at least for the recognizing who's in the need to know, and relax some of those so we can share that information a little better. Again, we're trying to flatten that curve, not isolate a single point and end it as much as just trying to flatten the curve out. But we all believe that that's information that we need to know so we can best protect, whether that be a neighborhood or a facility or a group of individuals, and really target that down. So that's as I understand how that flow is going today, but I'm hoping over the next few days, at least here on the peninsula, we'll be able to streamline some of that in a little better manner so it's a little bit more actionable.
So I appreciate that, and I appreciate what you all are doing very much. And I think some of my another piece of frustration is I don't think anybody's asking for. I don't. I am so sorry someone is ill. I don't need to know it's John Smith that lives on Pocahontas Drive. But I would like to know if John Smith went to the Centera 500 building on March 5th in this office, so that if other people were there, they know that they need to self-isolate until we know about Mr. Smith. That's where my frustration is going with the communication. I understand HIPAA. Well, I don't understand all of HIPAA because it's very, deep and long and wide, but I don't understand why we're not able to, and I guess though, as you're having these conversations, this is what I'm looking to you to try to help decipher. Why are we not able to say, if we do have a cluster here, okay, everyone that was at such and so during this time period, you probably need to stay in your home for 14 days until we know whether or not you're positive. And so it's kind of hard. It's great to flatten the curve, but if the right people aren't staying where they're supposed to, we're not going to stop it.
When it does make flattening the curve difficult if we don't have the right information. So as I understand today, they get confirmation of a positive case, and the epidemiologists through the Department of Health, specifically here in the Peninsula Health District, start making contact calls, and they have a series of questions to figure out where have you been today, yesterday, who you may have been in contact with, and then you can see that starts to sort of spider out, and they start to make those notifications, and then they're figuring out whose primary contacts were they, you were in close quarters, or once, showing signs and symptoms and those types of things, versus who may have come in contact with you as a casual conversation, so more of a second or a third hand exposure, and really narrowing those down to who are the folks that really need to be isolated or quarantined or whatever the right terminology that's deemed for them, versus who may be a notification level to just watch out for signs and symptoms and those kind of things. And so the epidemiologist.
Can I tag on? Ryan, can you hear me?
Yes, ma'am, we can hear you.
We can hear you.
Can I tag on to what Ruth was talking about with the flow of information? I think part of our frustration is there's just little tidbits of information all over the place, and we don't have a central feed in to what we're being told to the citizens know. Is there a way for, and I don't know how this works, but I just wanted to make sure there's a way for the Department of Health to let the county admins know in a timely manner what the latest update is, so that the county admins can relay that to us on a regular basis, because we're the ones that are getting the calls from the citizens hours upon hours, and rightly so. I mean, people are concerned. So there's all this information, all these little feeds of information, but it's not centrally coming in straight to our county admins in a timely manner, so that we can know what's going on. Can you help me with that piece of information?
Ms. Sadler, I would tell you, Chief Ash and I have been working on that all weekend. To your point, the information flow is not great. It is getting better. You are hearing from residents in the community because the Department of Health has called them directly without telling us. We have told them that is not helping us. We spent much of Thursday and Friday chasing rumors because the Department of Health was contacting our residents but not telling us. We still don't know who they're calling. We still are working on that. I do think we had a call with the State Health Commissioner and the Peninsula CAOs and Emergency Management Directors yesterday to express that frustration. The death in our community, you heard from a resident where that was located. The Department of Health would not tell us where that was located, I think due to HIPAA and some of those requirements. I do think what Chief Ash is working on with the Peninsula Health District and setting up the incident command structure and moving all those folks into one location will greatly improve that flow of information, but it has been some challenges to get there. We will get there. There's a lot of effort behind that. I do think it will get better, but it has not been a great flow of information as of yet to the localities. We talk about positive tests. I think we're hearing those pretty quickly, but what I want to know is if we drop somebody off that transported with us in EMS, I'd like to know they met the criteria and they got tested. We're not getting that as quick as we should yet because The test result is 2 or 3 days later. I'd like to know within an hour they're going to be tested. That way we could make sure that our team was wearing their protective equipment, and I believe we are. We've got our staff doing those things, but it would be nice to know that somebody met enough of the criteria to be tested. And that will get better, but it's not there, at least it's not to the satisfaction of me and the other CEOs, and I don't think of our chief or others yet. That's got to get better, and I believe it will.
All right, thank you.
Chief, thanks to you and to the county administrator and all the rest of our staff who are putting in enormous amounts of time and energy into this. I just had a couple of questions of clarification. The first is, are we confident that the number that is reported now by VDH is the number of confirmed cases in the county?
If you look at what's on their website, there are more cases confirmed that are on the website.
And so I think that it is vitally important that we convey that concern, that they have accurate information. As I read a news article yesterday, they were going through newly confirmed cases in various localities, and all too often there was the comment that that does not appear to be reflected in the VDH count for that locality. And I'm not talking about us, I'm talking about other localities out there. The thing that concerned me most about what you indicated as the testing goes forward with the private labs, has VDH attempted to make sure that rather than relying on the individual providers getting back to VDH to report these cases, that the labs themselves provide a central reporting to VDH?
And I can't answer that question. There's some of the reporting is done electronically, automatic, and some, I think, my understanding is it has to be communicated. But we'll definitely take that as an action item to follow up on in our meetings with VDH this afternoon.
Thank you.
It's Supervisor McGlynn, and the hospitals have been on our call. They have indicated they would work with us for the tests they runs to keep, so I think we'll get good local information, which is very important to us. The LabCorp issue and other private labs seem to be a little more difficult, but I'm sure that'll get resolved in the coming days and weeks as well.
One quick follow-up, and I apologize, regarding the doctor's offices. Are there doctor's offices in our area testing now? And are they feeding that information to VDH? Or that's part of LabCorp not knowing?
I don't know that positively the doctor's office are testing. I know LabCorp and Quest are offering some tests.
Okay.
So if that's being done directly at the doctor's offices, I don't know that yet. But we'll certainly find out.
Okay,
Yes, ma'am.
thank you.
Chief, question, and you and I talked about it, but just for the general public and to know, I'm sure most of the board members know, go over a scenario with when we get a call and what we do with our employees and all that we think it could be a possible, issue or not. We're not going on a regular call. We're going on a call that maybe. What is our action items that we go about when we go to a call like that?
Great question. So we implemented last week some questions through our 911 center. A screen initially was travel outside the U.S., and basically by the time those questions got started, they sort of became dated because once it was here, travel outside the USA didn't matter as much. So we are asking some travel-related or been in contact with a known or suspected COVID-19 patient, and our 911 operators are asking those questions on the phone and then forwarding that information out to field personnel so we can have some level of suspicion prior to going there. We're also looking for flu-like symptoms and fever, coughing, those types of things that would lead us into that way. Certainly it's flu season, so there is cases that aren't COVID-19 that probably folks believe is COVID-19. So we are kind of screening that off to give first responders as much information as possible going in. And then certainly they're walking in with a situational awareness of not that every patient is COVID-19, but every patient, I guess, could be. So they're asking those questions. We don't have enough personal protective equipment, and really this is not unique to James City County. This is honestly nationwide, to where we could just put a mask on every day from now for the next 3 to 6 months or whatever that period of time may be, and we just assume everybody has it. We're not there. So we're still, just like testing, we're still kind of screening that and triaging when we wear masks. We are limiting the number of folks who we typically, for a breathing problem, which is how we may get one of these COVID-19 related calls, we send the medic crew with 2 people and the fire engine with 3 people. So rather than commit all 5 into that room and potentially expose them, we're committing 1 or 2 crew members to really see what's going on. If the patient needs all 5 members to perform skills and treatment, all 5 are going to go in. But if they don't, we're limiting some of that exposure by limiting the people that have to be in the room. And that's not new. We do that honestly at facilities throughout the year as norovirus and other things like that go through. We do that as kind of as a regular practice anyway. So we're doing that, and then if we have to be in there, we're wearing our personal protective equipment. We do have N95 or N99 masks, gowns, gloves, all those types of things that we are wearing. And as we understand the CDC guidelines and the Department of Health direction, if a first responder is in protective equipment or a healthcare worker is in protective equipment, that is not an exposure because the equipment is doing what it's supposed to do, and it's not an exposure. So we don't need to worry about them being out of work for 14 days or taking the ambulance out of service. We're certainly deconning and cleaning the ambulance regularly. We do that after every patient anyway. So we're doing those, wiping down our equipment and bags, wiping the cab of the truck as the steering wheel. Eventually the driver gets in and drives the ambulance, and all those things that we do normally, we're certainly paying extra attention to make sure we're doing here as well. So then we transport that patient to the hospital. We're giving them a heads up if we believe they have COVID-like symptoms. We're notifying the hospital, so their staff is then aware. And then they turn them over and they go through their screening process, which is much more detailed than ours, to determine do they meet testing criteria or not. And as I understand, at least in some cases, they're ruling out some other things like flu and strep and those other types of things to make sure that they're using the tests where they're most appropriate until they're really widespread testing where you can do them more readily. So we feel like we're putting our folks in a good position to as much information as possible. Could something slip through? Could you have a case where they didn't show any of the signs and symptoms and you later find out? Absolutely. That's still a possibility for us. And that's where that communication with the Department of Health and with the hospital systems, that when they find out of a positive test, that information get back to us so we can go and find out patient, what day, what crew members may have been exposed, and then figure out the appropriate. Do they have to be out for 14 days? Are they for sure exposed? Is it a potential exposure? There's a lot of terminology, and one of the things we're doing at the regional center today is defining what's self-isolation versus quarantine versus containment, those terms. What do they actually mean? Let's make sure, at least here in the Peninsula region, we understand all those terms universally so we're speaking the same page. And then what is an exposure? What's not an exposure? If my cousin's friend saw somebody, that doesn't make it an exposure. And I know there's folks that are concerned about that, so we need to make sure we really help get that public information out of what counts as an exposure and what's not. And we're doing that for providers, and then also want to get that same clear message out to the public.
And I think that's important to get out to the public, today as well. And because there's a lot of, conversation going back. Is anybody doing anything? Do you know you should be doing this? You should be doing. And I think, that it tends to become a snowball effect with people. They get worried, which I don't blame them, and get concerned. And that's why I wanted just to bring that forward and let the citizens know that we are proactive. We are doing something. We are protecting our people as well as the citizens to make sure we don't spread this and flatten it out. And we're taking precautions, and we're letting everyone know what's going on during this process. I know that we're not getting a lot of the information we need as far as from other outside our departments. And I just wanted to tell the citizens how well our departments are doing and how well we're on top of this, trying to do everything we can in order to keep our community safe.
So
Brian, did I hear you, you were breaking up a little bit, did I hear you say that your team does still need more protective equipment, and if so, what do you need?
Yes, ma'am. So I think that's a problem throughout the whole region and throughout the state. At least here on the peninsula, every department has a cache of equipment. What point that will run out, we're not sure. Obviously, that depends on the number of folks that we're encountering that meet that criteria for us to put that on. We have made requests through the state, and the state is working on filling those. The Virginia Department of Health does have some extra supplies that we can use. Here on the peninsula, we do have some other equipment caches that been funded through some grant processes over the year that does have some additional equipment. But we're trying to be careful to make sure we don't need that 2 months from now and we use it all today. So we're making sure we're really focusing on those good triaging points today. So we have put those requests in, and I know the State Department of Health and the Virginia Department of Emergency Management is working on filling those requests, whether that be through the Strategic National Stockpile or working through other vendors to get that as well.
Thank you.
The other point I would just share about the doctor's office, as our citizens, as the Department of Health tells us, some high percentage, I've heard 80 and then I've heard 90% of people who have this could have mild symptoms. You heard Dr. Oliver say on the phone on the interview earlier that they could have a severe pneumonia and those types of things as well. And then there's certainly a percentage that are the critically ill that may end up on ventilators and in our hospital systems. So folks that suspect they have it, they should call ahead to the hospital or call ahead to their provider before they show up. Not everyone needs to go by 911, but if you are in an emergency and you feel like you need to go by 911, certainly that's what we're here to call. But if you have some slight symptoms or you're concerned, you can call your own doctor. They can do some screening over the phone. I know some of the healthcare systems are working out telemedicine options, so put you on FaceTime or on a Skype type thing and work through some of those questions and maybe prevent you from exposing additional people at the healthcare system or first responders. And so it's certainly not that we don't want to come, but we may not need to come. But in the cases that we do, absolutely don't hesitate to dial 911. We just ask that you please do share the information as much as possible, or your loved ones share with us that you potentially meet those signs and symptoms so we can put that appropriate gear on. So there's a flattening of the curve to the public, and then there's certainly a curve within first responders to make sure that we continue to be able to sustain that manpower and sustain healthcare workers, whether that be in the hospital or doctor's offices, over the duration of this as well.
Chief, would you do you might have hit it one time, but the first contact, second contact, third contact, and the Department of Health's guidance on that?
So I hope I'm saying this correctly. There's been a lot of information running through my head in the last couple of days, so I hope I'm saying this information correctly. So let's suppose that there's a positive patient and you're in direct contact with them, and there's some definitions of close contact, meaning really within that 6-foot range, or maybe a little farther, but it's a sustained time period where you're absolutely exposed. You're the second-hand person, or you're what they would put in, I guess, in a suspected contact. If you then were to go that same day and meet with someone else, they're sort of a third-hand contact. So that would not count as an exposure. But the epidemiologists of the Department of Health are sort of tracking all those contacts to be aware that if you then test positive, we may need to notify Ms. Larson that, hey, you were sitting next to him a day after or something that hand. So that's, as I understand, the second and third-hand contact with it and what counts as an exposure or not. We really want to clear up that message, and there is a lot of CDC guidelines. If anyone's taking the time to look at that, some of those are a little long to read through, so we're trying to get them to, let's streamline it down to a one-page, something our communications folks can push out to the region, and let's sort of clarify some of that and put some definitions to some things.
Thank you, Chief. And the second is
can I tag on to that, please? I was on a teletown hall with Congressman Whitman last night. His medical experts were Dr. Dacey, President Riverside, and Dr. Williams of Three Rivers District, Virginia Department of Health, Dr. Wright, Vice President Medical Affairs at Centera, and I think they were doing the same thing. We're clarifying what this self-isolate means. They were getting those terms straight, and I know you guys will get that clear. One of the things they should say is self-isolation is if you are positive, but I know you all will get that information out. One of the things I was able to ask a question that I had heard on a press conference that the president had put out about supply trucks and point, and we're overloaded. But they assured us that they are we're in good shape with Centera and Riverside right now, and they've got all that they need right now. So I just want to put that out there to you guys.
I had a couple of things. First of all, I wanted to compliment the staff on finally getting our website and the hotline up there. You're able to go to our website. The very first thing you see is the COVID-19. You click on it. You've got a telephone number for the hotline. You've got direct access, and things are being posted at a appropriate rate. So we are putting out the information at the county level as quickly as we can get it. I think some of our challenges have been getting that information, and but what we do get gets out there. I will tell you, pardon me, tell you that my biggest concern has been the slowness of some of the testing. I think that that is a factor, and maybe not. If we had quicker turnaround on the testing, we might be able to flatten the curve a little bit more. And I think our communications issues, which have already been highlighted, I appreciate all the work you're doing to try to rectify that. One of my concerns is I had a conversation with a James City County resident who was exposed and is on self-quarantine and was aware of a large number of people in a group that they felt were exposed. And it was direct exposure to somebody who was confirmed. So they're sort of self-quarantining. And they were going through a process of contacting each other in the group that they were in. And I did not have a level of comfort that that information had worked its way into the official Department of Health figures, or that they were aware of it, because I got the clearer understanding that they had not been contacted by the health department at the lower level of this group. And so what we did was provide a phone number for them to contact you down there. I would like to see if we could work on something so that we could have the public, people who are in a circumstance like that think they may not be, officially counted or aware, to be able to reach out to your organization and be reassured that they are in our site pattern, if you will, that we are aware of it. Because I think there's some places where we're just not aware right now. So if you can, anything you guys can do to try to set up some sort of portal and advertise it so that people who are in that circumstance can contact our regional or Peninsula Health Department, that would be greatly helpful.
And I have a question regarding Matthew Whaley. I'd like to know, when was that, there's nothing that can be done now. It's done. But moving forward, I do think we have to take lessons learned. We obviously are ill-equipped as a country, and, it's just, I don't know if we didn't expect this. I certainly didn't. I didn't think a whole lot about the fact that James City County has a lot of residents that are older that are affluent, so probably traveling, and boy, I didn't expect it to come quite as fast as it did to our county. So I think what we can do, though, are lessons learned, and God forbid we ever have anything like this again, we'll have a little better idea about how to deal. Before I ask the question, I just again want to reiterate how much I know what you and your team are doing, and I appreciate it on a regional effort. It's life-changing, truly, I think. But I would like to know, when was Matthew Whaley, when was the volunteer known to have the coronavirus? How quickly was that information put out to the schools? And in turn, how quickly did the schools act? So that's not something you can tell me right now, but that's where I think that's some of the concern too, because how fast did they move on letting us know that? So, but again, that's not to be answered now, but later on. So again, thank you.
Supervisor Larson, if I could just comment, not so much into that, but I will tell you the information flow, Department of Health. What I know is there was a couple that we've tied 6 of these 10 cases to, right? So one couple, 6 of these cases are tied to that one couple. There were calls back to people that interacted with that couple, and we've learned this after a couple days. The couple's test, as I understand it, was positive Wednesday of last week. But that was in the 10th or 13th of March. They were calling people that had interaction March 3rd with them, because those are the calls we got that were saying, I've been called, do you know anything about it? And the answer is we didn't. So that timeline, when we say, can you give us the timelines, when did they come back into the country? And we were told sometime in February. But there's getting that information has been almost not possible. And I don't know if it doesn't exist because the health department is ramping up that kind of information flow and charts. I will say they've shared that couple not doing anything wrong has led to, I mean, they had a little cough. It wasn't anything significant. I think it could have been any of us in here interacted with a lot of people. They were just, I mean, it's what our community does. We go to parties. I had my mother yesterday having a committee meeting because she feels fine. That is terrible advice. We should not be having meetings because we feel fine, because you're infectious, as they say, a long time possibly before you show any symptoms. So when people are thinking about should they go play cards today, they probably shouldn't. So the information, and I guess back to where I was starting, the timeline of flow of information has been challenging. And I think the health department will get better. I think they'll get much better. But as the cases balloon, we're going to not have as many, we're going to know less and less and less and less about the why. And so right now they're still trying to trace them, but they have said at some point that'll quit. And so we are working on that. The chief's effort in Newport News, I think, is our best, at least for our locations, to get that better flow of information. Having somebody in that call center helped us over the weekend with information flow. So again, it's going to get better. But to your point of having when they were there and what happened, and it just doesn't seem to exist where we can get it.
I think it's also very important to remember that if somebody does have corona, it's not a fault. It's not anything, they came into contact with, with a piece of something. It's better to be honest and let people know that you've come into contact with that, so they can stay healthy themselves. I don't want, someone shared with me today that someone was being treated as a piranha because they had someone very close to them. Let's not do that. Let's embrace somebody giving you information so that you can act accordingly and realize that any of us, could have this as well at some point. And so we need to work together, not shun our neighbor. So to shun them physically, but not emotionally. So, thank you.
I think to the point of, so from epidemiology standpoint and from folks who are sort of in the fix-it business, right? We like to know as much actionable information as we can and make direct actions to stop things. In this case, when it's in the point of being limited community spread or likely to be in Virginia deemed community spread, at that point it's more widespread, and it's each day that timeline Mr. Stevens talks about is harder and harder to narrow down. And not that it becomes less important, but it doesn't necessarily change the actions that we need to take. So the good social distancing, hand washing, not gathering in large groups of people, all those things that we've been pushing out for a week or so on throughout public information is still the things we need to apply, even though we're still hunting down those timelines. Because to your point, we may need to put a cluster, we may need to take specific action for an area or a facility or something more so than the general precautions. So I encourage people that really just need to focus on calling ahead your healthcare provider if you think you have it. But in the meantime, good hand washing, social distancing, heed the warnings that we've given here locally at the governor's office and at the federal level to keep those small groups limited or keep the large groups limited down.
Scott, I have a question regarding WADA. Are WADA services, are the buses running? And if so, what's being done to limit the spread? Because originally they said this lives on hard surfaces for 3 hours. I learned yesterday on the call that now they're thinking it lives on surfaces a lot longer than 3 hours. So if the buses are running, what's being done on those buses to limit the spread of this?
Supervisor Sadler, I will follow up with Zach Trogdon, the WADA director. I did speak with him over the weekend, or maybe yesterday, but recently. They are still running. They were running on a somewhat limited schedule, but still running. He said they had taken precautions on the staff side and felt their distancing was okay. I am certain they're doing some more cleaning within their buses, but I will verify that with him and then share that back out. I know he had those conversations, and again, he and I did speak over the last day or two, but I will follow up with him and be able to share that with you later as well.
Thank you very much.
Okay, pardon me. If that's, I think at this point what we ought to do is open it up for the board to talk about anything you think we need to concentrate going forward.
Don't we have other presentations?
We have a few others, Mr. Chairman.
Oh,
We're
we
happy
do.
to go
I'm
any
sorry.
route you like. I was going to let social services talk a little bit about the community and
Absolutely.
assistance
Okay.
there, sort of county operations, and then a little on communications. So
Hello.
Hi.
Hi, I'll be as brief as I can, 'cause I know you guys have a lot to talk about. As far as what we're doing, our essential services are open. As you know, we have things that we need to provide on a daily basis to individuals who are vulnerable. So we are continuing to perform all the duties we need to perform to ensure people have their SNAP benefits, their TANF, their Medicaid. Certainly that's important right now. So we're doing all of that. We do have a lot of ability of some staff to telework. And so when people can telework, we are having them telework. We're trying to limit the amount of people who are together. As far as our protective services, we're continuing to do the home visits that we need to do. However, we are doing phone screenings. We are doing a lot of heads up, a lot of information. The more information we know, the better. But we still need to be sure that our folks are protected. Certainly there's a lot of stress going on right now, so we want to make sure that people are getting what they need for our services. As far as community partners, we have been working very closely with our community partners to make sure that individuals are taken care of. We made an effort over the weekend to ensure that individuals who were in the Cofen winter shelter, who did shut down early, were put into safe places and hotels. So we worked closely with our partners and with the City of Williamsburg Human Services on that. So they're getting what they need, so they're not out on the street at this time. We also have been working on distribution sites for food. So we all know what the schools are doing, which is wonderful. They're really limiting, their distancing, but making sure that school children have food that they need, because a lot of them rely on the school meals. But we're also making sure that other folks have access to meals. So there are community agencies in our area who do a lot of a lot of distribution of meals. They are monitoring themselves. They are doing a lot of the drive-throughs, a lot of the keeping the groups, to 10 or less so that they can distribute. So right now we feel like we are doing the best we can. We do have some communities, agencies, they're a little concerned about supply. And so we're having them let us know if they do get low, if they need assistance, we might, we need to see what we can do to make sure that people have food. That's a major thing right now. If they can't go out, can we bring it to them? So that's a lot of what we're working on. We're certainly being mindful of our seniors and making sure that they're still getting the assistance they need. So we're communicating with our partners on that. And really right now we're just doing a lot of communicating, a lot of making sure we're checking on people. I've gotten some requests from people, how can they help? I think right now if you're in a church, for example, you can help with your congregation. So you can do a lot of phone trees, a lot of texting, a lot of how are you doing, what do you need? Certainly people need to limit their interactions, but they also need to help themselves. So it's really a balance between, informing people, making sure they have their needs met, without alarming them. And so that's really what we're doing right now. So is there anything I haven't addressed or any questions you have?
I've got,
Oh, go ahead.
okay, I've got a few, and, we've had several people say we ought to close everything down, and as we know, we can't close everything down. There's a lot of people in the community that depend on services and depend on us to keep the county moving and running forward. I thank you for all that, because there's a lot of people that would go hungry, that wouldn't get their meds, and some people, if they miss one day of meds, it really upsets the whole cart. And it's important that we stay distant and we make sure we have that space and we're washing our hands and doing all that. But we still have it's county, but I say a business to run in order to take care of our citizens, and that's all our citizens. So we've got to make sure that the people that are out there in the tents and that sort of thing that would rather stay in a tent than some other place that they have the ability, and WADA as well had the ability, because some of these people, the only way they can get around is through WADA. And if we shut too many things down, then we're hurting the people that really need the services that they're depending on that we give them. So I think it's very important for us to keep a focus on that with our libraries and everything else, that some of these places that people go in order to warm up or cool down and that sort of thing. So, we've got to keep our eye on that as well. I know that I sent it to the county administrator. I know he and assistant county administrator and all have reached out. Mark Morrow with Crosswalk Community Church said he'd be willing to take his congregation, step in if there's a place that we need him anywhere in the community. And I'm sure there's other churches that the same thing. And So, if we can utilize them on, in order to try to space things out and give us some more space, and you need that type of help, that it's good to see the citizens in the churches, and I've had a lot of citizens say, how can I help? What can I do? What do y'all need help with? And, and I'm praying for this board and make sure that, they have the strength they need when they're going through this. So we've got to come together, and it's not closing us down. It's figuring out how do we work within what we've been dealt. And I think that's very important.
I think I spoke with a faith-based provider that I talk with a lot, and I think, kind of the recommendations is, if you can stay home to help flatten that curve,
Right.
do so. If
That's
you have the ability, we have people who, need to subsist on wages that makes them go out and about. And so if those of us who can stay home and still subsist on our way, we need to do that to help flatten that curve. And those folks who want to help, again, we may need them, so take care of yourself now, take care of your family now, and then take care of your congregation and your community now, and just stay tuned.
That's right.
Be on
That's right.
standby.
Hold tight. We may need your help.
Exactly, yes, yes.
Good.
Are we maintaining any kind of a central information source for volunteers that are
We
coming
have
forward?
not formalized that right now, but we have basically, like I just said, we know who to call if we need it. So we certainly have taken note of all of those. We have, a main number, a couple of hotlines at our office that people can call, and so we've put that out. As far as the news release, if people do need assistance, they can call us and we can help vet what they need. And those phone lines are answered Monday through Friday, 8 to 5, whether somebody's in the office or not. We'll get that information. So we do have 24 access to our staff as far as those calls. And so I think at this point, I don't want to mobilize volunteers right now just because of, again, if you can stay home, please do. We want people to stay healthy when and if we do need them. So I think the staff at those particular agencies, I want to commend how hard they've been working, because a lot of them have had to work more because the volunteers have stayed home. And so we really want to be thankful of them. And so we want to be able to backfill if they need that assistance too. So I feel like we are communicating, and that they just need to call us and we'll say, what do you need? Certainly the supply issue, we're going to be keeping a close eye on if we do need to help with the supply on the food, and also, like you said, with the assistance of people to distribute it.
I want to thank you, first of all, and I want to thank staff that is really stepping, as always, because, I try not to be too combative on social media, but I did, I did get kind of upset on one of the sites recently. I think feeding children, the most vulnerable, is imperative. And it's not, if this goes much longer, we're going to be faced with more than eating. We've got people who have to work. What are the children going to do? I so appreciate your words, because you're right. If we cut WADA off at the knees, we are a service industry town that is seeing some real impact, and I know it firsthand. So I hesitate to, say, okay, well, you don't have transportation any longer to even get your essentials. We've got food deserts here. People need to get their groceries. I can get in my car and go to the grocery store. So, I appreciate how thoughtful we're being, but it was like, we gotta feed the kids. Have the buses do it. The bus drivers. Well, the bus drivers and the cafeteria workers are some of our lowest wage earners. They have children too. Perhaps we need to relook at who's giving out the food. Maybe it needs to be the higher paid that are receiving a salary regardless. And I think people need to keep in mind that there are some places that people are going to continue to receive a salary because of the entity that they work for. There's other people that are already, we had to lay off 30 people yesterday. Not here, but in an area of this Commonwealth that doesn't even have a case yet, but because people are not traveling. So, I just ask that we all, and I so appreciate that you are keeping that in mind. But And I think if we're going to see, my hope is that by acting as quickly as we have to sort of start not having these large gatherings, et cetera, that we will see this sort of start to get returned to normal. I've read a little that China, Apple stores have opened back up, only 4 cases, I think, the day before. That's been a month ago. So, that's a good sign that with, 30 days, when we first heard how horrible it was over there, within 30 days now, they're starting to see life slowly returning to normal. And I truly hope that that's what we're looking at as well. So, sorry, that was a little bit of a rambling, but I do appreciate very much what you're doing.
And to your point about the schools, they have to get waivers for certain things that they do, but I know they are doing everything they can to get those when they need them. And so they are certainly been very mindful of that, and I've been in communication with them around.
Thank you.
I will tell you, I've had several calls from churches, and we passed that information along through the county administrator to you. I think there's an overwhelming sense in our community, especially in our church groups, to be of service, to help. And I think it's important that you have that resource and you work with them to use them how and when it's most effective. So I appreciate all the work you're doing on that. And if we get any more, I'll continue passing them along to you. But thank you.
Rebecca, I'm getting a lot of calls from churches as well, so thank you for the info you put out about that. And to Mr. Eisenhower's point about having a central info place for volunteers, so everybody's on the same page and we know what everyone is doing. Is that something that you think you'll be getting together in the near future?
Yeah, I think we can certainly talk about that. I mean, I think for now, as I mentioned, turning inward in the church and seeing how they can help those who are in their church and who kind of touch their church, that's the right word, is the best thing to do. Because I think if those pockets are taking care of each other, that's a good start. Because I know people want to get busy and they want to be productive and they want to help. And then once, we see if there's outside needs, then we know who to plug in. So certainly continue to send those to me, and I will work on a way to centralize that when we do, or if and when we do need them. But I think right now the best thing they can do is turn inward and support themselves. If there's elderly folks in their church, visit them, call them, text them, those kinds of things. And
Right.
then we'll go from there as far as anything
So
else.
are you putting together protocol for church members who want to help within of what they need to do to protect themselves and other people? Would there be informational resources for them so that they know exactly what to do? Just want to make sure everybody's on the same page.
Right, I can work on that. Like I said, I did get some good tips from someone yesterday, so I can work on maybe coming up with a tip sheet or there were some really creative suggestions that he had. So again, I know people want to be busy and want to help, so sometimes just having some ideas is helpful. I know, like, we're getting the ideas for our kids at school, some of the ideas for that. So I'll work on that and get that sent out.
Thank you, and thank you for all you're doing. I know everyone really appreciates everything you and Ryan and the whole team are doing to help the community and help keep everyone safe and informed. You're doing a great job.
I would just add that our neighborhood HOA president sent out an email to the serve list and said, are there people that are willing to go out and get groceries for people or whatever that can't do that?
That's wonderful.
And so the response was so wonderful. And of course, being careful too that we're not so sanitizing before we
Right,
drop,
yes.
but leaving
Here
on the
you go,
porch.
then ring the doorbell.
Right. But sort of there's 4 people who people can reach out to, and then they can spread
Yes, that's
to
a
more
great
people.
example.
But yeah, so neighborhoods can step in as well. So
I just want to emphasize, I think, part of the underlying message that you're providing us with, Ms. as well, and that is simply that it may not seem like it to people, but a part of service right now is this notion of staying home and helping to prevent this further spread. That as much as everybody wants to get out and do something active to help, recognize that really is service. because I know a lot of people would like to be doing something else than staying at home.
Thank you, Ms. Van Root. And next you have?
We're going to do county operations. Jason
very
Purse is going to
good.
give you a sort of overview of that.
Everybody's up to speed on where we are with county operations, but for the folks watching, the county offices are open but closed to the public. So this is all of the facilities. We're trying to discourage folks from coming in. We have online services available for just about everything we do. Rebecca talked about what social services is doing, but community development has the same thing. You can turn in all your plans. We actually have a portal where you can pay online as well. If you do have paper plans, we have tables set out front that you can drop them off. So we're trying to anticipate all the possible needs for folks, but we just want them to know that we are open. We're available to take phone calls. We're answering emails. Scott and I have talked with ELT, our executive leadership team, and we've tried to make telework available for those folks who have the ability to do that. We're trying to encourage folks to distance as much as they can in the office as well. We don't want to have a lot of intra-office meetings. That way we can ensure that if somebody does get sick, we've sort of minimized that potential exposure. So we're trying to have more conference calls and all of those things as well. I will note that the parks are closed as well. We don't want public going to the parks. I talked with our parks director this morning, and it seems like folks are still going out and playing basketball, so we're going to have to try to limit that as well. I think there were a couple big groups that were playing at War Hill yesterday, so we're going to have some folks monitoring that and making sure that folks aren't going to the parks and congregating. We want folks to get outside and to get some exercise, but activities like basketball is not a great idea right now, so we're going to have to monitor that as well. Scott, was there anything else that we had
To
talked about?
confirm that, Jason, our local playgrounds are closed, correct?
Playgrounds and the rec center are closed.
Okay, because that was something they talked about yesterday on that conference call. All right, I just wanted to confirm that because I've got HOA things coming out saying playgrounds are open, so, yeah, okay.
Yeah, no, all the playgrounds and parks are closed until the 29th at the moment.
I would like to maybe see if we can reach out to all the HOAs, because I have had some email contact from folks in certain communities in my district that have their own playgrounds or, fields and stuff. And they're getting a lot of activity because there are a lot of kids in the community, of course, that are naturally going to congregate there. It's belongs to the HOA. It's not us, but I think we ought to provide to all the HOAs guidance that we would like to see them limit that use. I know they've done in my neighborhood, all of it's been closed. So I think the only thing open right now is the walking path, which is getting a lot of use.
And Jason, to your point earlier, I think you covered things very well. The only thing I would add too is the convenience centers. You might have mentioned them, Jolly Pond, and our convenience centers are open and available. We would ask folks, they may have to help themselves a little more than us jumping in and getting too close, but we do plan to have those staffed and running regular hours. And then regardless of where we are answering phone calls, we are responding to emails. We would just ask patience in the community as we're wrestling with some of it, but we are here still working for the community, so we'd encourage them to talk to us as they have questions.
So parks are closed.
More the facilities within the parks. Jason did say parks closed, but he came back and said, we want people to go into the parks and walk around on trails. Okay. Anything that does a gathering in our park is closed.
Okay.
Right, to your point of basketball, those are decisions where we're struggling with information. We're deciding that's a bad idea, and then later the medical community sort of confirms that. But anything where you have close contact, the playgrounds we have closed. Things where you're doing basketball, we would not want people doing those kinds of things. But to come out and walk, I think people have to have a place to go. And at this point, we're still allowing that as long as they're not gathering under our shelters and those kinds of things, because those gatherings of 10 or more now are certainly being highly discouraged.
Yeah, the
One of the
Capitol
things
Trail.
the doctor spoke about yesterday in terms of playgrounds was things that germs that can live on the hard surfaces for an extended period of time. So that was something that why they were encouraging also the playgrounds be shut down. Temporarily, that is.
We have trails at War Hill and Freedom Park. Those are all open.
So if somebody needed to call the county and didn't know what staff person to talk to about their issue, what's the best number that they're going to be able to call and get a human at some point?
In what respect? So we have services that are listed on our website, and we have FAQs about who do you
But
talk
remember,
to for
there's
a dog
people like my
license,
dad
or-
who are almost 80 years old. He doesn't have a computer. And so not everybody's got a website. So there's got to be a phone number that if somebody has a question about James City County, they're not going to hit 1, hit 2, hit 4. What number can they call so that they can possibly get somebody?
So we have a citizens guide that has all of that information in it that's printed. And it depends on what service you're looking for. There's not one number that
don't
is
have
a
a central
county number. I mean, that is,
Yeah, I think Latara will be able to address
Okay.
that. I mean, to Jason's point, we don't have one place set up that answers all questions. I think Latara will give you some information on our communications.
Yeah, no, I'm
agreement
not looking for
that will help.
one magic number that answers all questions, but one magic number that could say, social services 2.
We'll get there where Latara can
Okay.
help you through that. And we may need to set something up that would be more of a tree. But again, Latara will start with, if folks have a question today, they'll have a number they can call if they don't know where else to call.
That's
So-
okay. And then how long can we see, what are we looking, so we've closed our county buildings through the 27th, I believe.
29th.
29th, sorry. So what's going to be your yardstick? What are you looking at to go, okay, we're going to open Monday, we're going to open our buildings?
I was about to say, I think we're following a lot of the state guidance. We're trying to see what the health department is saying about safe interactions and sort of seeing what that community spread is.
And just talking with the doctors in the health department, I think and localities are talking regularly. We'll all do something similar, I believe, on the peninsula area. The cases have to get up here and have to start dropping off.
Okay.
And so does that happen in 2 weeks or 5 weeks? We don't have that answer yet.
Okay.
As we get better reporting data, we see the peak and it starts dropping, then I think we'll make the decision probably in a week and a half about what we do beyond March 29th. My guess is we'll be pretty good at doing it this way, and we probably will extend that a period of time. I just don't know what that will be yet.
I really think what we're trying to do now too is monitor what sort of interactions we are having with staff, with citizens in terms of being able to meet all the services. We want to make sure that we're serving the citizens as to our greatest ability. So if we find we need to correct course a little bit, if we're having problems with plan review or things like that, we'll have to make those adjustments. I think that's more important right now. That's what we're trying to focus on.
Any questions?
Mr. Chairman, I say last, but at least our last sort of discussion item from staff, I did ask Latara Rouse just to be able to talk about communications in general and what we're doing and what else you certainly could share with her, what more you'd like to see. So, Latara?
Thank you, Mr. Stevens. Thank you all for inviting me to give you a little update about what we're doing in terms of communications regarding this sort of unprecedented situation before us. So understanding that we have some challenges in terms of information flow, which we've discussed earlier, we are asking the public to direct any sort of medical questions about coronavirus outbreak to the Virginia Department of Health. Their website, which we have posted in our news releases and we reiterate through our various channels that I'll go over in just a moment, is www.vdh.virginia.gov/coronavirus. And they also have set up, the Peninsula Health District has set up a call center that's going to be operated from 8 a.m. to 6 p.m. Monday, actually 7 days a week. That phone number is 757-594-7069. And again, all this information is on our website. Citizens can also call the Department of Health public information number at 1-877-ASK-VDH3. So we are understanding, again, those challenges in terms of information flow we have tried to put together a range of options for citizens to get information, understanding that, to your point, Mrs. Larson, people get information through a variety of different ways. So on our website, if you go to jamescitycountyva.gov, right in the middle of the page, you can see a link to the COVID page. That's got a list of our latest press releases. It's got those resources that I just named, and we are updating that regularly. So we also have our news releases going out at least once a day at this point, understanding that the situation is changing hourly, minute by minute sometimes, and we are prepared to ramp that up if necessary. But at least no less than once a day will we be putting out a news release. It's usually at the top of the news release has the latest information, and then underneath has all the information that we've put out previously. So we're trying to make sure nothing sort of gets lost as this information is constantly refreshing. We also have a public information number that we've established. Again, that number is on the homepage. If you go to jamescitycountyva.gov, it's right in the middle of the homepage. The phone number is 757-564-2140. And again, Mrs. Larson, you brought up an excellent point, which is that we understand not everyone has access to the internet. So while we're pushing out lots of information through our website and social media, we do need to make sure that folks that do not have internet access also have a way to get up-to-date information. So what we're doing on that number is it's actually a recording of our latest press release, all of that information, so all those numbers that I've just mentioned, all of that information is going in that recording. And so people can always call. Again, that phone number is 757-564-2140. And we also have assembled our emergency PIO team, our emergency public information office team. It's a group of 11 employees that are that have mobilized to help support our public information office and getting information out to the public. So that team is going to be monitoring social media for updates as well as websites, anything coming out from VDH, from the Department of Health and the Governor's Office, and we're trying to push that information out as soon as it becomes available. We're also sharing reminders with the public about how to limit disease transmission through social media, and we're responding to questions and comments from the public through social media. We're also working on establishing a Facebook chat. And I believe Chief Ash mentioned the Joint Information Center, that we also will have a PIO present, a representation present there to work with the other localities in the region. And other things that we're doing is updating, of course, signage that's on county buildings, updating the TV channel as needed, and internally we are making sure that we're communicating to our staff as well, because that's another important audience. So posting information, we're sending out information through email. That information is getting posted on the employee portal, and we also have an employee hotline that we are updating with the status of closures and that sort of thing. So I'm happy to take any of your questions.
Any questions?
I probably got more of a comment than a question, and I'm sure y'all have heard it before. You can't have more important thing going on right now that you need the internet for all the way across James City County. And Cox Communication is our supplier for the internet, and we still don't have the internet across James City County. And there's citizens out there, and right now, and I'm one of them, that can't access the internet because Cox serves James City County, but not unless you have X amount of people in James City County. And we're seeing that problem now even more in that our children are out of school right now and need the internet. And because there's not enough people out there and it's not going to make the company enough money, we're not going to put the availability to have that out there. And that's a crying shame this day and age that a company's allowed to do that and not serve the entire community. So that's my 2 cents on Cox.
And I'm going to follow up with that and ask, do you know what Cox, I've noticed that Spectrum pushed out, I believe they're in another part of this Commonwealth. I think it was a friend of mine in Richmond that maybe told me this. They're offering free internet for students that are out? I know Cox has some sort of program, but have they pushed that out a little bit more? I'm unaware, so it's not accusatory, just would like to know. And also, T-Mobile put out mini hotspots for the students in Henrico. I'd be curious what Verizon's doing for our students. Verizon seems to be the big one around here. Are they putting out hotspots for people in Michael's situation where he has students in WJCC? He doesn't have internet. So if there's any way to find that out, I'd greatly appreciate it.
Yes, I'd be happy to look into that. I do know that some of the internet or the cell service providers have been putting out messaging. I know I got a message last night that T-Mobile's expanding unlimited services. So we can look into that. I don't have the answers for all of that right now.
I understand that. I just would like to know.
Sure.
I did see in one of the news things that Cox has the program for people that can't afford, that have the service but can't afford internet, that they're going to supply that and go from 30 megabytes, I think, to 50, so that they can get all their schooling done. So Cox, where they are providing that. Okay. So I'll give them that. I mean, good is good and bad is bad. And so I'll give that part to them. But I know with, if any of you have an iPhone 7 and you do an upgrade, my son just did it yesterday, and we were over 9 hours getting the phone back into service. Right in the middle of an outbreak, you do an upgrade that cuts your phone off totally during the upgrade. So we had to get a whole new phone and all that because the other 7 wouldn't. And I think that, these companies should be looking at, if these upgrades, something, I'm sure there's a way. We can put a man on the moon. I'm sure there's a way we can get rid of this long enough to get by this. And then after we get through this issue with this virus going on, that then we could go back to the normal way of business. But I'm worried there's a lot of citizens out there that may do this upgrade. And now the Verizon store over there on Monticello closes at 5 o'clock. So there's a lot of people that are going to be stuck without a cell phone. And I'm worried we might have that issue coming up too.
It's going to be very interesting because college students are returning home. William and Mary's going to online for some time, for a bit of time. Do we have the bandwidth here to support all of we're going to a lot online.
Yes.
It's going to be interesting to see if we've got what we need in order for it's like these college kids take this week off and then next week we're going to all be good to go. And I don't know if that's all going to be, if really the Commonwealth is ready for all of that, but that's not your issue to solve, so.
Can you take care of that for us?
Yes.
I'm on it.
I would only add one comment for the benefit of Mr. Hippel, is that the man on the moon didn't have an iPhone.
He would today.
Can I just follow up on the county number that you provided us with just a minute ago, the public information number, and I'll repeat it, 757-564-2140.
Yes, sir.
How much capacity does that actually have? In other words,
recording can. So it's just a recording.
It's just a recording.
So,
it's not going to be something that would allow people to get
ask
information.
Questions. Right. And so first of all, to answer the first part of your question, there's a recording. It's up to 10 minutes long. So we're close to 10 minutes. It's quite long. But it's just to get all the information. And again, all of that information is available on our website. So, but in terms of people's ability to call in and actually ask questions, again, we're directing people that have questions, medically related questions, to the Peninsula Health District's call center, and that phone number is 757-594-7069. That's going to be staffed 7 days a week, 8 a.m. to 6 p.m. And then for questions beyond that, the Virginia Department of Health, their main number is 1-877-ASK-VDH3. Now, I think earlier, I believe it was Ms. Larson asked, and Mr. Stevens referred to a phone number where people can call. Now, understanding that you can call normal department numbers for the county. But if someone is not sure, if they have a question for the county, they're not sure where to direct it, you can also call our public information office. That phone number is 757-272-3330, or sorry, 3337. So 757-272-3337. Thank you.
Latara, this is Sue. Hey,
Yes, ma'am.
thank you for getting that hotline up. I think it's going to be very helpful. Quick question: do you have the health department numbers and COVID information right up front at the front of that recording? Because the people who have contacted me, that's primarily what they're wanting to know about. So, do you have that information right up front?
Yes, ma'am. It's currently, we actually just discussed that this morning. It's a part of the recording. It's currently mentioned later in the recording. For today's message, we did have a discussion this morning that we will make sure we mention those numbers right up front.
Great. Thank you so much.
Yes, ma'am.
And you sound great on that recording, by the way. Thank you.
Well, thank you.
Okay, any more questions from the bench? Thank you.
Thank you.
Mr. Chairman, if I could run through a few items, and I probably won't pause for questions unless you make them, and then we'll turn it over to you at the end, and maybe we'll come back if you have questions. I do want to just let you and the community know we have been focused on the emergency response for about the past week. And again, we've had a lot of time and effort. We've had others thinking beyond that. I will say I've talked today with our FMS director, Sharon Day, and our treasurer, and Jenny Tomes, have been talking about budget impacts. So I just want to at least address highlight of current year. Probably a $2 to $3 million loss in revenue for us. That is a changing number, but based on what we believe today, that is probably the impact of current year budget. I will tell you, you have $36 million as your fund balance. So we have financially, the county's in very good shape for the next couple of months. So I feel very comfortable with that. We are holding expenditures. So while we expect some revenue shortfall, Ms. Day and I are both going to be much more involved in purchases that we normally wouldn't. Normally, once approved, some level of spending occurs in the departments. Today, she will see anything that's over $5,000 expenditure. I will see anything beyond $10,000 expenditure. And our message to departments will be, if you don't need it, if it's not essential and you're not going to have it, we're not buying it. And there'll be some things that we've got out there, some of the projects we've talked about, some of the purchase orders that are in the current year that we haven't yet issued, some of those that are there. If we can pull them back and hold off and determine they're non-essential, we want to do that so we keep the county in good financial condition. So we are making adjustments to that, and I want you and the community to know that. One area we've had some questions on, or two area, one, can we waive late fees on tax payments? Your ability to do that is somewhat limited, and our attorney, we could address that maybe at a future meeting. You have very limited ability, as I understand it, state code, to extend deadlines or waive the penalties in most cases. There are a few exceptions to that. But the convenience fee is the other question we've gotten a lot on. Since you want us to do more online, you want us to pay, are you willing to waive that fee? It is a cost to us, but in talking with Ms. Day, we expect that impact, if you were to waive that this year, would be about $150,000 loss of revenue. But that is something, if you'd want to consider, we'd be willing to talk through that. And I think that might make it easier for some of our community to feel like doing business online with us would be better for them. I do want to mention businesses. They are very important to a lot of the discussion here. We don't know what the overall federal state assistance will be to our business community, but our Economic Development Department has been tasked with reaching out and promoting to businesses to keep up with their losses, their loss of business, their loss of revenue, or their costs associated with this. We are trying to work consistently with Williamsburg and York and having that same messaging out. And so I would encourage our businesses to call our economic developer, 253-6607. You can get it through our website, but again, 253-6607. We don't have any promise of federal assistance, but I believe there will be some help, and tracking those costs from day one will be easier than trying to recreate them in a month or two or three. So we are trying to work on that. I did talk with Doug Powell at JCSA. I think he has reassured you as well as me, our water supply is safe. They expect it to continue, and I just wanted to make sure the community knew we were thinking along those lines as well, that we do expect this virus that's going on has zero impact on the water supply and the safety of it. It does affect our employees, of course, or could, so those are things he's working on the staffing side. We are on daily informational calls with our other localities, meaning Williamsburg, York, and James City, along with the two hospitals, the school system, Colonial Williamsburg, Jamestown Yorktown Foundation, our own conference calls with our Department of Health partners daily. So we have been doing that daily since about last Friday. I think that will continue, these calls with the localities. So we are sharing information and often hearing it more often from our partners in the region than we are through some other sources. So again, just so the community knows, we are talking and communicating very well. We have regional calls within the Hampton Roads community and the CEOs and emergency managers as needed. We've had 2 or 3 of those since Friday, so they're not a daily call, but they're a regular call that are things important to the region. And then we've had state calls when needed. So I do want the community to know that we are doing all we can to stay on top of this and be informed and sharing information with them. Last topic for me, and well, 2 things. One, future board meetings. We'll have some guidance on how we might anticipate future meetings. Our attorneys are working on that. State code didn't envision not being in the same room, and right now you're supposed to have a majority in the room to have a meeting. We are trying to work through this. If it's long-term, if the spread is worse, how do we have meetings and conduct our business so the public can see it, but that you don't have to physically be together? We have separated you here. I think we're following the guidance today. But if it gets worse and more in our community, it may be we need to do remote calls where all of us call in. And so they are working through that and trying to figure out how we would do that. And then maybe not a decision for today. You've got a work session a week from today. We may talk about what that means as the days come with your chairman to see, do we meet together or do we do it some other way? And then, as I said it earlier, I would just ask the community, call when you need us. We're here. Do have some patience with us. We're doing some other things than we might normally be doing, but we are here to serve, and we'll continue to do that throughout whatever the duration, whether it's 2 weeks, 4 weeks, 10 weeks. We're going to keep working through that as well. So, Chairman, I'll turn it over to you.
2 things I would suggest. If you have any questions, we'll do first questions for the county administrator, but then we'll wrap up with any guidance that you would have for staff or the county administrator about what you would like to see us thinking about or working on as we go forward with this. So,
and I know we've talked about it quite a bit. I've talked with the county administrator quite a bit on this last week on financing and not only the impact that it's going to make on our community, but the companies that are now out of work. And, you know, Senator Norman putting out the thing yesterday that talked about $444 million in school loss just this year in Virginia, you know, and those kind of dollars are going to affect the state as well as they're going to affect us. So I'm wondering if we're at the end of the day going to be able to find any relief from the state, because their debt's going to be like ours, overwhelming possibly, if this goes on too long. I'd like to look at not only this coming budget, but the next year's budget, because that's one that's really going to be affected, and what we're looking at as far as losses and that sort of thing. And we had talked about bigger projects and that sort of thing. Maybe might not go forward, and we might push them off a couple of years till we can recover from what. But I want to let the citizens know that, you know, we're looking at that budget item. We're not sitting there just worried about what we've got to do to keep the citizens safe and all. We've also got to worry about their future as well, and the county's future, and where we're going to be money-wise and budget. And that's always an important thing in the community. You don't like to talk about it much, but, you know, you have to. It's part of business. And looking at those items and making sure that we're covered and we have a plan in place. We've done very well to put money in reserves so that we have this and we're ready for something like this. We didn't think this would be coming this soon or we would have this issue, but I'm glad years ago we started doing that and even upped it. And it's going to help us in the long run. But we're going to have not only that, but the other shoe that's going to drop is the community. Some of them are going to come back in the community and say, hey, I need help. I can't afford this. I can't do this. You know, if my business is running, okay, how do we bridge that gap? And will that be a cost to the county? Will it not be a cost to the county? So, you know, I almost think we need a team of 3 or 4 working on this and saying, okay, what do we look like that we're going to lose? Busch Gardens is out right now, and Jamestown, you know, we don't know what they're going to do. And the, you know, we don't have the students that are in school now that are going out, and we don't have heads in beds, as Ms. Larson said. You know, that's a lot of people out, and we're going to lose a lot of people that are not going to, and we're going to have more services going out as well. to help the people that are struggling right now, that are working these service jobs for us. And that's going to be something on our budget as well. And then our employees, the ones that are going to need to take off and that this could affect, and will be a shortage there. We might have to hire some people in temporarily to cover that, or maybe to do with what staff we've got. I know we're lean on staff to begin with, and so all those are costs that are going to be associated with this, that we just need to let the citizens know that we're going to be out in front looking at these things, not only this year, but next year. We're going to look out 2 years beyond here and see where we're at. We won't be able to pin it down, but we're going to start that process and make sure that we're securing their future in James City County and their investment that they make to us in their taxes. Thanks, sir.
So can't promise this is my last question. I did want to know if we could take a moment. I see that the chief is here. So I was wondering if he could come up and give us some idea about what protections are in place as our police officers go out on calls. We've heard about EMS, but I'm sure police are going to be put in a position of possibly going to a call where somebody may not know, may be infected. So
Yes, ma'am. I'm sure Chief Reinheimer would be happy to give you an update on
Thank
where
you.
he is. And
Sure, absolutely. Thank you all for allowing me to be here. And first, I want to say this. I know they've done this some other parts of the country, but with all the cutbacks and everything we're trying not to do, I just certainly just ask all of our citizens and visitors, don't commit any crime.
yeah,
So that would be a whole lot easier for us.
yes, absolutely.
But, drive safe, be careful out there. And we obviously, when we aren't seeing the traffic on the roads we normally see, a lot of people are heeding the warnings to stay at home, which is great. We are measuring our response. We've changed a lot of things about how we operate as far as exposing our officers to each other and the public when not necessary. We've canceled our Citizens Police Academy, our Citizens Forensics Academy, and a lot of the large gatherings that we typically do, we've canceled those or postponed those. So we're doing a lot to try to protect our people. We're doing teleworking like the rest of the county is trying to do when we're able to. Obviously, that's a little more challenging for us. For the majority of our department that's in the patrol function, they just simply can't just call people. Sometimes they have to show up. But that's something that our dispatch center is doing, as well as when they do speak to people that call in, to see if we can handle it over the phone instead of having to show up. So we're trying to change the way we operate so we don't have as much personal contact with people. But unfortunately, in our job, we obviously have to have personal contact with people, and encouraging our officers to use the PPE gear that we supply. And obviously, if they've been exposed, and we have none as of now, we do have a few officers who are home sick, but it certainly could just be the flu or anything. We don't have anything confirmed. But just trying to limit that personal contact so we can maintain that force that can continue to function, and we're confident we'll be able to do that. We expect the possibility certainly is there that we might have some exposures, but we'll deal with all those as they come.
Thank you.
Welcome. Any other questions for me? Thank you.
Thank
Hope everybody goes along with your crime. Do not commit crime. So a question that I had, Mr. Stevens, is what are we doing about employees? I imagine there's something, full-time employees, because we are open.
Right.
What are you doing with the lifeguard at the rec center with the pool closed? What are you doing with the, a park person where there is a Kidsburg, for instance? What are we doing there? Are we not paying? All right, and if we are paying, how long can we continue to do that fiscally?
yes, ma'am. Well, a couple things. One, all of our first full-time staff we've committed to paying so far. We haven't not paid anybody that's full-time staff. There will be some impact potentially to our part-time staff. So anybody that's full-time, we are either using them in their capacities, or with the rec center, it's a good time to be cleaning. Or we've got some of the rec center staff helping at our convenience centers. Our convenience centers are typically older people. They're still there and good at directing on site. We were trying to limit their interaction with credit card payments and other things from an elderly person. So we've put in some of our Parks and Rec staff who are generally younger and trying to limit that exposure of our employees. So our goal today is to keep our full-time staff employed as best we can and keep paying them as best we can. We have encouraged those that feel bad to stay home. If they have sick leave or PTO, to use that if they're feeling poorly. If they don't have leave time, to let us know. At this point, we have agreed to advance leave, so they would get paid for these next few weeks. Many localities are granting a couple weeks of sick leave to those if they need it regardless, and so we likely will move to something similar to that, but we've not made that decision yet. But our goal is to keep our staff earning their paycheck, but doing it in a safe manner. And if we can telework them, that's what we want to do. If we can have them here, that's what we want to do. And there'll be some opportunity for part-time staff, but that's the group that I worry about the most, is what do we do with part-timers? We will have some work for some of those. Maybe it's not as much for some of the others, but our full-time staff, at least today, I believe we'll keep well employed and gainfully employed over the coming weeks, maybe doing something different, but still performing services for the community.
I appreciate the flexibility that you all have shown in that, because there's an awful lot that our people are doing today that they have never done before, and that's a tribute to their ability and the leadership that you've stepped in, and we've got things running, because I want folks to understand that the essential services of this county have to go on. We've got to do that, but we've got to do it in the safest manner we can, and I really appreciate all the work that's gone into it from all of our staff, and I can't thank you enough for that. Any other questions?
Well, I just like to comment on I think Mr. Hippel, points correctly to the fact that we're going to have to pay a lot of attention to this going forward because of the fiscal implications of it all, and to make sure that we're providing good services. I think for our citizens, it's also important to recognize that we are sort of the frontline frontline government in relation to their everyday lives, but that the state and the national government should be expected to provide assistance as well here. The governor, you heard just a little while ago, talking about waiving of the week's waiting period for unemployment benefits. I think it's important for us to make sure that citizens in the community know that if they have been laid off, that there is an opportunity for them to apply for those benefits now. And so maybe including that in our public information if it's not already there. I know Latara is probably getting everything she can possibly think of up in that briefing. But that's an important consideration. There's a bill that hopefully is going to move in Congress that would infuse about, I think, $850 billion and will include provisions for significantly affected industries like airlines and the hospitality industries and so forth. What the nature of that assistance is going to be, I have no idea, but certainly it's something we want to try to make sure that we are in contact with our federal officials to create as seamless an opportunity for those businesses as possible. And I understand that there will also be another piece of legislation that will be moving along that will try to address things like access to child care and sick leave, and in addition to that, perhaps even some direct stimulus to the economy. I know Senator Romney is proposing a $1,000 payment to every citizen, every adult, and I think there are some people talking about doing it to every citizen, which would be a $30 billion infusion of money to the nation, and would help obviously deal with some of the short-term immediate needs of paying rent and buying food and so forth. But I think we need to recognize that we are part of a federal government that does mean that we have certain roles to perform, and we have less flexibility in fiscal terms than those others may, especially the national government, which does have the ability to, and the well-honed practice of borrowing in deficit and so forth. So I think it will help us, though, if we can provide as much of that information as it comes available to our citizens.
Yes, and I would encourage people, the president is doing a press conference. I'm at home, so I'm watching it on TV. Doing a press conference now, and I too would encourage people to stay tuned to these press conferences. The governor just had one, president's doing one, and they can gather a lot of information from watching these press conferences as well. I know they're talking about, they're trying to get these test kits and everything as fast as they can get them. I mean, it takes time to produce these things. So, they're working around the clock trying to help the communities and the citizens as quickly as possible. But I just want to thank our county admin and my colleagues on the board. I know we've all been working around the clock to try to help the citizens and to keep everyone calm and to know that we're all working together as a team. Our staff has been amazing, and we're doing everything we can to try to answer everyone's questions and just to stay tuned in to any kind of information that's being put out there. And I think that in itself will help answer a lot of questions. So thank you to all of you for everything you're doing to work together. I think we've all come together to work as a great group, a great organization for our community.
I think I've talked a lot, but I do very much appreciate what everyone's doing here at the county and everywhere, frankly. My deepest sympathy to that we know that there has been 2 people who have lost their lives with this coronavirus, and also to those that are sick. It's a tough road to go, and I'm sure it can be and I'm sure there are people isolated right now that are scared to go out in our county, don't know who to call upon. I hope that there's a chance that they were possibly watching this today and will reach out to a neighbor or a member of a church that can help in any way possible, because I think the more information that they can get, the better, and I am certain there are people that are willing to help. I hope the information, frankly, and I'm sure, Mr. Stevens, you're quite frustrated at all the phone calls that we've been giving you, but it's frustrating that information isn't flowing like I believe it should. I believe this is a public health crisis, and people tend to poorly react when they don't have communication. So even if that communication is we don't know, but we will let you know as soon as we can, is communication. But when a website says one thing and you hear something different, that causes people to doubt and to come up with their own theories on what's going on, and that isn't helpful for anyone. So I implore the Commonwealth to, do everything they can do to help the health department get the information out, get accurate information out. And I also urge us as we go through not only our own budget, and I agree with you. I mean, we're going to see a fiscal impact from, we need to do the right thing, but there's an impact to paying for work that there's not able to be done. So we have to be very wise about our money and talk about, okay, what can we put off this year in order to do the right thing? But some of probably the aggravation coming from the health department is probably because that's a budget that's been cut some more. And then when you're faced with a time when you're really relying on that department, they may be doing the best that they can do with the resources that they have. So, I hope we can pay attention to what things people do provide to us so that in a time that we need them, we have them. So, but any information you can keep flowing. I certainly hope we're able to meet for our work session next week so that we can keep things going here. And I do appreciate the staff that is coming in, that's telecommuting, whatever they're doing. I am certainly grateful for that. And to the grocery store people that are staying open, the gas stations, this is tough, and it's tough on the service industry. So, my thoughts.
I had one question that was the county administrator asked us to consider, and that was, do we want to waive the credit card convenience fee for a specific period of time, or
Fiscal year would be a time if you wanted to do it.
I would think that would be okay.
Mm-hmm.
If we're going to have everybody try to keep them at home and use credit cards more.
So we are passing
that on right now?
The complete amount on, so we're not profiting in any way from any And so what's the fiscal impact if we do that? I mean, I know you said the amount, but is that are we cutting that from something else, or?
That as a revenue item, it's about 150,000 is what we would estimate the loss of revenue. So we'll still collect the amount of money we're collecting. We'll have $150,000 expenditure to the credit card companies that we have to figure out. So we lose that revenue.
And so where would we normally put that revenue that won't get that revenue now? Does it just go in does it go in the general fund?
It is a general fund item. Currently, it doesn't show up in revenue or expenditures. It's a flow-through item, what we call a flow-through item. We collect the cash and then we pay it right back to the credit card company.
Oh, yeah, that's right. I'm sorry.
So there's no profit per se.
Okay, sorry.
And
I
it
had a
is an
moment.
estimate. It's an estimated fee because depending on what credit card they use, it varies. So sometimes there's a little bit of a difference. If there is a difference, we carry that forward. It's always used to pay those credit card payments. So what is being proposed, if we were to waive that fee, is it would be offset against the revenue. So rather than show up in the budget as an expenditure item, it would just be offset against that revenue.
Okay.
So essentially, it's a loss of revenue.
I would think we would want to do that. I mean, is there a way to do that right now through May 1st and then reevaluate where we are on May 1? I do think it's, and I speak as someone who mailed my recycling payment to myself, so it came back. So if I could pay that online, that would be great. But I do think that is important. If we're saying don't come here, but hey, in order to not come here, it's going to cost you money.
And I also think it would have a positive impact on the cash flow because it would be an additional way folks could pay, so the likelihood of us accepting more cash would go up. I do know that IT is in contact with the various vendors that we use, depending on the software, meaning whether you're paying for a Parks and Rec fee, whether you're paying for taxes, whether you're paying for recycling, they're all different vendors. So IT has been in contact with them to find out what their lead time would be. It would require some reprogramming of those systems. So they made those phone calls and those outreach today.
So essentially, we would, if we said, yes, let's go ahead and waive this, it would take a little while for the staff to implement. But once it was implemented, then we could, we're looking at going for the fiscal year through the end of June would be what was proposed. Is that okay?
Oh, okay.
Just to clarify, to make sure I heard it correctly, you're looking
redo
at waiving the fee through the end of June?
That's the proposal for the rest of this current fiscal year, to waive the convenience fee on credit card use, which would be the end of June this year, and then we could reevaluate at that time.
Okay, thank you.
Motion for approval?
Okay, we have a motion for approval. Mr. Stevens?
Ms. Sadler?
Aye.
Mr. Hippel?
Aye.
Ms. Larson?
Aye.
Mr. McGlennon? Aye. Mr. Eisenhower?
Aye.
Motion carries.
Okay.
Got a few things.
Okay.
This has been very tough on the board, staff, and the community, as it's changing every day. We're committed to our community to do our best and to keep you as safe as possible. We're asking that you keep a distance of 6 feet, less than 10 people in a gathering, and people of 65 plus, please stay home as much as possible in order to be as safe as you possibly can. Ask at the restaurants that are, doing takeout and delivery, that if we can as citizens, if you want to eat out, just change your ways of eating out, maybe have a delivery or go in and get a takeout at the door. Definitely watch out for each other. Watch out for your neighbors. This is a time that we definitely have to tighten up and come together and watch out for each other. This is definitely a time for prayer in our county, our state, and the United States of America. We need to unite and realize that through this, we'll all come out better and we'll all come out together. But it's just going to be a bump in the road as we move through life. And this is something that we need to take to, better our community and better ourselves as we figure out ways to, deal with a situation that has been put in our arms. So I ask that the citizens just, it's easy when you get frustrated to lash out and get angry and say a few things. All of us do it. I do it myself. So it's just human nature. But as the stress becomes a little bit more on you, you're not able to work, you're not able to get out and do the things you want to do. and you're not able to move as freely as you normally are used to, that remember everybody else is in the same boat, and we're all neighbors, and we're all part of a great community. So I ask just for a little bit of guidance and kindness, and anything that this board can do for you. All of us, all 5 of us, are working very hard together to make the community what it is, and our staff is working extremely hard under difficult circumstances, under a lot more work than they usually work under because of the added stuff, not only just from the calls that the board members give daily, but all the calls they get from the community. So I ask that each one of you understand that and help us, and together we'll all get through this. Thank you.
Mr. Chair, may I just offer a comment, please?
Sure.
I would just like to offer my deepest condolences to the family and friends of a citizen in the Stone Health District who recently passed away from this illness, and to let them know that we're ready to serve. Anything that we can do to help in any way possible. I want the community to know that we are here to help. Our phone numbers are posted. We will do anything we can. But that was my main thing, is that I did want to offer my condolences. It's very heart-gripping to know that what's happening here in our community. And with those condolences, I also want to extend my thanks to staff and to my fellow board members. I know personally myself, even with bronchitis, I was on the phone for about 15 hours Saturday, and I know my other board members have been doing the same, and we've all been communicating with each other. We've all been working together as a team. So thank you to all of you. Thank you to everything staff is doing for the community and to help us, because a lot of times we're on the front lines, the citizens. So with that, thank you all, and thoughts and prayers to our citizens.
Okay, thank you. And I'll conclude with thanking our staff again one more time, especially for the regional cooperation. This is something that we have to do as a group in the region, and on that same theme, it's something we have to do as a community here in James City County. We are responsible for each other. Essentially, we are our brother's keeper. So let's take that attitude and deal with this as we go forward. And I thank everyone in the community for all the help they've been giving us. If that's all we have, I will take a motion for adjournment until 4 p.m. on March 24th, 2020 for the work session.
Motion?
You have a motion?
Ms. Sadler?
Aye.
Mr. McGlinnan?
Aye.
Ms. Larson?
Aye.
Mr. Hippel?
Aye.
Mr. Eisenhower?
Aye.
Motion carries.
Okay, we are adjourned.